Endometriosis of the parametrium is one of the most missed and most difficult types of endometriosis to treat. The parametrium is the connective tissue next to the uterus that contains key nerves and blood vessels. Endometriosis here is challenging because it's hidden deep in the pelvis. It involves critical nerve pathways controlling bladder and bowel function. It can look very subtle even to trained eyes. Even surgeons who regularly treat endometriosis in India and worldwide often miss parametrial disease. And when this happens, patients are left with persistent pain and nerve symptoms even after a successful surgery. The risk, once a difficult area like the parametrium is left behind, the next surgery becomes far more complex. Scar tissue from the first operation adds to the challenge, and the nerves can be even more difficult to dissect to access safely. I've seen this firsthand, including in a case where a doctor who was herself a patient came to me after surgery by a very well-known endometriosis surgeon. The parametrium disease was left behind, and what could have been a challenging but straightforward case became a much bigger surgical challenge. The bottom line is, if you have bladder, bowel or nerve symptoms along with pelvic pain, make sure your surgeon is trained and experienced in parametrial endometriosis excision, because this is where even good surgeons can miss disease. Share this with someone preparing for surgery. The location of disease matters just as much as the diagnosis.